I'd like to welcome everyone today. Thank you for joining us for the Sight and Sound Bites webinar. Today's topic is very timely as it's been all over the news lately. It is everything you need to know about over-the-counter hearing aids. And this webinar and discussion will be led by a true expert in the field, Dr. Catherine Palmer. As you know, the Eye and Ear Foundation hosts the Sight and Sound Bites webinars every month, featuring different topics related to vision loss and hearing loss, head and neck cancer, sinus, allergy, balance disorders, and conditions of the voice. My name is Carrie Fogel. I'm the Senior Director of Development for Foundation Relations with the Eye and Ear Foundation, and I'll be moderating today's webinar. A few quick reminders before we get started with our presentation. We won't be using the chat function, as you can see during the webinar today. Instead, we ask that you submit all of your questions to the Q&A box at the bottom of your screen in the middle. And following the presentation, I'll ask Dr. Palmer all the questions that we get. We do ask that you keep questions general, not ask about any really personal conditions that may not be relevant to everybody in the audience. And you can feel free to submit them at any time throughout the program, and we will make sure to get them asked at the end. If, however, there are any questions we don't have time to answer, if we have an onslaught of questions, we will send those to Dr. Palmer after the program, and we can get answers to you via email following today's webinar. Also, there will be a video of today's webinar available later in the week on the Eye and Ear Foundation website. With that, I'd like to welcome our speaker today. Dr. Catherine Palmer is a professor and interim chair of the Department of Communication Science and Disorders and a professor in the Department of Otolaryngology at the University of Pittsburgh. She serves as the Director of Audiology for UPMC Health System. And her research entails auditory learning, post-hearing aid fitting, the relationship between hearing, cognitive health outcomes, and matching technology to individual needs. She's published over 100 articles and book chapters in these topic areas and has provided over 200 national and international presentations. She also teaches graduate level amplification courses at Pitt and serves as the editor-in-chief of Seminars in Hearing and served as the president of the American Academy of Audiology for a few years. So I'd like to hand it over to Dr. Palmer and thank her for being here today to teach us more about the new world of over-the-counter hearing aids.
Thanks, Carrie. It's my pleasure to be here. So, and I'll tell you, I guess, a little bit of my qualification to talk about this. For the last 3 years, I've been working with the American Academy of Audiology as the chair of their task force related to OTC hearing aids. And they had a task force in order to provide consumer information and to help audiologists get ready for this new reality. So in terms of consumer education, if you go on to the AAA website, the American Academy of Audiology website, there are frequently asked questions from consumers with answers there. So that's a nice resource if you find you have other questions, but hopefully I'll answer a lot of them today. So this is just a timeline, and we're not going to go through this in detail, but just to give you a sense that this has been rather a long time coming. With the first meeting by the National Institute of Health in 2009, really bringing together experts and stakeholders, trying to think about how to make access to hearing care more affordable, more accessible, like physically accessible and more affordable. And then it really wasn't until 2015 and 16 that more happened on this front. And what happened is PCAST, which is the president's panel that advises on science and technology, did a report on aging. And in that report, they included hearing because most aging adults, if they live long enough, end up with some level of hearing loss. They considered that really a public health issue, and access to devices was part of that report. And that's different, and we'll differentiate that throughout the talk. Care or services separate from devices. So their focus was on the devices, the actual physical devices. And same with the NASM report, which is the National Academies of Health, reported very similarly to PCAST, same kind of thing, looking at aging adults, looking at access in terms of affordability, and how many appointments it takes to maybe get the products they were hoping to have to help their hearing. So with these two in mind, these two reports, Senator Chuck Grassley and Senator Elizabeth Warren, who don't actually often work together, came together and created the Over-the-Counter Hearing Aid Act of 2017. So they put into law the request that the FDA come up with a category of devices that would be over the counter, so direct to consumer. So you bypass any kind of professional help, and you could directly get some kind of device that would help, potentially help with hearing. And in that report, they directed the FDA to do that within 3 years. So we should have seen this in 2020. But as you all know, a lot happened as we entered 2020 with the pandemic, and the FDA is certainly busy with a lot of, obviously very important things that they were doing. So for a variety of reasons, this was delayed. And finally, in 2021, the FDA did publish an original draft of what these rules would look like for these new category of devices. And then they received about 937 comments. So that's part of that process. When the draft comes out, anybody, organizations, people can comment on the draft. Certainly our academy did, as did many others. The FDA then responds to every one of those comments in a formal way. And the final rule came out in August 17th, 2022. So just the end of this summer. And then the first products were allowed to be on the market October 17th, 2022. So really almost exactly a month ago, we could see the first products, and we'll continue to see products coming out. So it's just a little bit of a history of where this all came from. And again, this was all about access to devices, not access to services. So, and I won't harp on this during this talk, but something to think about is what we don't have is health insurance that covers both devices and the services needed for people to wear those devices well, for them to be fit and people to be supported in how to use them. That's a different problem. And when we really think about access, perhaps the more important problem. So that's where you'll see bills. We've had a couple bills that haven't passed at this point in the last year, trying to get Medicare to start to cover hearing aids and the services, both that go with them. So I like to mention that for you to keep your eye on that as you're voting and thinking about what's important to you, that will take an act of Congress to change Medicare law. That would be for vision, hearing, and dental, and they're usually grouped at this point. But that's a different kind of access and an important access for people to have these kinds of things covered. The Over-the-Counter Hearing Aid Act is not any kind of insurance. These devices are not covered. These devices are not being provided by the government. It's just creating a way for consumers to pay out of pocket directly for devices without having to go and receive a hearing test or the other kind of care that is more traditionally associated with using hearing devices. So what they're meant to do is increase access, again, by creating this self-care pathway. That's what pharmacists, the word self-care, pharmacists often use when people can just manage their own care. And that can be something like you can buy aspirin or Tylenol over the counter. And certainly on the bottle, it warns you that if you have a terrible, terrible headache and it doesn't go away after taking this, you should see a physician. And the same thing with over-the-counter hearing aids. The idea is you have a self-care pathway, but if this doesn't do what you need it to do, or if you end up having pain or any other kind of problems, then you would go to an audiologist or an ear, nose, and throat specialist to then get the care perhaps that you need. This should be for adults with perceived mild to moderate hearing loss. It's perceived because remember, they've created a pathway where you don't need a hearing test. You can just buy this online or in the pharmacy or in a big box store. So this would just be your perception. So the problem potentially with that is we know from years and years of research that individuals don't actually identify the level of hearing loss they have. People are not accurate. People with mild loss often report very severe loss, mild measured loss report perceived severe loss, and vice versa. People with much more moderately to severe hearing loss may think they have a mild problem, but it's their perception is how the rule is written. And then they would try a device, and if it didn't help them, that would probably be a good indicator that they needed to go to a professional and actually have a hearing test and have more help with that. So again, available without any professional assistance. And a lot of the law really talks about not constraining this trade, not constraining this product base. And so this is a federal law. It's coming from the FDA. The law came from Congress. The rules come from the FDA. And so they're preempting state rules that have dictated more traditional hearing aids. They're not changing that. They're saying the states can dictate the more traditional hearing aids that are dispensed by audiologists and fit by audiologists, but that they can't constrain the over-the-counter devices that people can get directly. So the state can't put on like extra requirements. That's the whole point of the FDA rule, is to get rid of those requirements. So what the FDA didn't do, actually, even though the law asked them to make a category of devices, they didn't actually do that. So when you think of hearing devices, there are 3 categories currently that the FDA regulates, and they're called class 1, 2, and 3. So class 3 are the most highly regulated, and those would be like cochlear implants. So those are devices that are surgically implanted for people who have no hearing. And then class 2 are hearing aids that most audiologists fit, that have some wireless capabilities. And so they're more sophisticated instruments than class 1. Class 1 we tend to call legacy devices. They're just simpler hearing aids without some of that connectivity and use of Bluetooth and things like that. So it turns out the over-the-counter hearing aids can be either class 1 or 2 devices, just depending on what they do. So for instance, if they have connectivity to a smartphone, they would be a class 2 device. So it's not a separate category. And that's a little bit confusing for people. So in this rule, the FDA realized they really had to separate out the definitions of what we think of the more traditional hearing aids. You go to an audiologist, they program it very specifically for the individual. They're now calling these prescription hearing aids. So the idea of, in a sense, we use a prescription to do that fitting when we make all the measurements to tune the hearing aid. And then there are over-the-counter hearing aids. So those are 2 different types of buckets when we think about hearing aids now. Again, the over-the-counter, direct-to-consumer, they can go on the internet, they can go to store. Prescription hearing aids, you need to go through a professional who actually knows, how to fit those and tune them for you. The biggest difference between these devices, and a lot of people ask that question though, like what's the difference, really is the intended use of the device and what you might think of as guardrails that the manufacturer would put on the device. So you can imagine we have 6 big manufacturers of traditional hearing aids or prescription hearing aids. So what they could do is they could take their kind of lowest entry level hearing aid and they could set it up with some constraints that are required by this over-the-counter hearing aid rule in terms of like how loud it can get, how adaptable it is, how adjustable it is. And they could put some constraints on it and they can call that an over-the-counter hearing aid so a person can get that directly. And then they can lift those constraints and then it could also be a prescription hearing aid. So that's maybe a little bit hard to think about, but it really is the intended use of the hearing aid and then those guardrails of how it's constrained that would make it an over-the-counter device versus a prescription device that would be fully functional and have the capabilities for the audiologist to program. So just because you're going to hear different words, there are personal sound amplification products. They've been around a long time. People call them PSAPs. These are not allowed to be advertised for helping with hearing loss. These are meant to just enhance hearing in certain situations. The example of if you're someone who enjoys listening to the birds, you might just want the birds to be louder so they're easier to identify. Then that's how they would advertise a PSAP. Now, that doesn't mean a person with hearing loss can't use a PSAP. They certainly can, and they do all the time, but the manufacturer can't advertise it for people with hearing loss. Then there are hearables. That's what you would think of like your AirPods. So if you have a cell phone and you have earbuds that came with it that lets you hear what's in your cell phone, that's a hearable. Or if you have a set of a Bose headset that's wireless, that's a hearable. So we think of hearables as wireless earbuds or headsets that let us hear things, not necessarily tuned a certain way for hearing loss, but certainly with a volume control, you could turn them up or down. Then there are the OTC hearing aids, which I already talked about, and then the more traditional prescription hearing aids. So I thought I would go through just a few of the rules that came out about these devices, just, kind of in case you're interested. So the FDA first proposed that these devices could be up to 120 decibels, which is extremely loud, and would be damaging to hearing if you really exposed yourself to that, even for a short period of time. So they lowered that. So typically these won't go over 111 dBSPL. There's certain combinations where they could go up to 117 dBSPL, depending on how the circuit works. These are both levels that could injure hearing if someone really listened at this level for a long time. But remember, this is the maximum it can go up to. So we don't expect people to wear it at this level, but there's nothing stopping them from that. So people would want to be thoughtful with how loud they're wearing the OTC. And in that sense, I'll just put a plug in. If someone buys an over-the-counter hearing aid and they're not sure about how they set it or how loud it really is, they can come into an audiologist and we can measure it, because we can measure anything that makes sound. We can measure it for them and give them some advice. So most audiology clinics, and certainly all the clinics at UPMC, are already set up, and we've been set up in the past for having a price structure so people can pay us a nominal fee, come in, and we can help them, figure out how to put it on, figure out, measure it. We can do that with any devices. And keep in mind, and you're probably all aware, now this has been formalized. So we have this whole class of over-the-counter hearing aids, and they have to be labeled that way. So the manufacturer who makes an OTC has to say this is an over-the-counter hearing aid. But we've had direct-to-consumer amplification devices for my entire career, which goes more than 30 years now. So we're not, we're no strangers to measuring these kinds of devices and having patients come in with something they purchased and aren't sure if it's really suitable for them. Something to keep in mind if you're thinking about this or you have friends is the FDA is not requiring the manufacturers of over-the-counter hearing aids to allow return. So on the outside of the box, so before you buy it, it's meant to be printed on there. It's going to tell you the return policy. So it'll say no returns, or it'll say it can be returned and maybe in some length of time, a month or 90 days or something like that. I would strongly recommend that if you're thinking about this or a friend, you want to purchase a device that can be returned. Since you have no idea exactly how it's going to work or if it's going to help you, you really want that ability. And over-the-counter hearing aids are not going to be inexpensive. For the good products right now, or at least speculating, that's going to probably be between $300 and $500 per device. And if you have hearing loss in both ears, you really should use 2 devices. That's how we know where things are coming from and how we hear a noise. So that's like $600 to $1,000. So that's still not inexpensive, which again is why we're very focused on working towards healthcare insurance coverage of devices and services, because for many, many people, this will still make amplification devices out of reach. Many people who don't have several $1,000s also don't have $800 to spend on these devices. So, with that, I'll just remind you, and I think many of you know, in Southwestern Pennsylvania, nobody needs to go without hearing aids. We run 3 free hearing aid clinics, all supported by the Eye and Ear Foundation, and we're very grateful for that. So people certainly can get not only the devices, but the services they need at no charge. So how are these devices fit? Well, oddly enough, with all the time it took, the FDA was completely silent on this topic. So I thought I'd tell you a little bit about what they require, which is interesting. The FDA has decided to call this customization. I think a better word for it is adjustment. This is the adjustments that have to be available. And so there are 2 adjustments that must be available on an over-the-counter hearing aid. One is volume, so it just has to have a volume control of some kind. And the other is there has to be a way to have a difference between like bass and treble. So those are pitches. So the high and low pitches, you have to have some way to have some adjustment for those. So 2 types of adjustment, one in pitch, one in loudness. And so how you might do that is on the bottom of this figure. We created this figure for the American Academy of Audiology to help try to educate people. So on the left-hand side, what you're seeing is the most simple device, which is have onboard control. So right on the back of the hearing aid, one button might give you more high pitches, one button might give you more low pitches, and then you'd have a volume wheel. So that would be the simplest kind of iteration. The next level would give you the same kind of controls, but it might be on your smartphone. So the smartphone could be talking to the hearing aid and let you do this. But it's interesting, these are all just now coming onto the market. We just became aware of a device a couple of days ago that indeed your smartphone can control these things, but only when the device is in the charging unit. So the smartphone's actually talking to the charging unit, not to the hearing aids. So that's the kind of thing where you definitely want to be able to return those, because you wouldn't know that when you bought them. But for any of you who've ever worn any kind of hearing aid, that would be wildly inconvenient if you wanted to turn your hearing aids down and you actually had to take them out, put them in a charger, which means you're carrying the charger with you and it needs to be plugged in. That would be really inconvenient. So you'd want to be able to return a device like that. The third box over would be something like an onboard control, a button that has some preset programs. So some with higher pitch, some with lower pitch, different volume levels. That's another iteration that you could see. And the fourth over is called self-fitting. These will be the more sophisticated devices, the more expensive devices. This is the first device that Bose came out with. So now you'd have an app and a program probably that's presenting tones and you're reacting to them. So it's doing an online type of hearing screening. And depending on your responses to those sounds, it's using an algorithm to try to customize the fit. So a little more sophisticated with the user interacting with sounds and then that interaction helping fit the hearing aid. So that's generally the categories you'll see if you look at any of these devices. Interestingly, the FDA is not requiring any kind of 800 number or phone number to be in touch with whoever sold this to you. You have to have a website and in some kind of way to electronically contact them. And this may partly have come from the Bose experience. So Bose was the first one kind of working in this direct to consumer, or the first one under these rules working direct to consumer. And what they found is they had far more phone calls than they ever expected of people needing help. Now, I will say as an audiologist, none of us were surprised by that because people need help. These devices, even the simplest, are not that simple when it's not something you work with all the time. So this is something where, probably in audiology, this will move people more to come see us because it's maybe not going to be that helpful just to interact in a chat on a website, whereas you probably need a person showing you or helping you with this. And again, audiologists are happy to do that. These are not for children. The law specifically states only for people 18 and over. You won't see the pharmacists asking for ID, but hopefully they'll, be responsible about this, and I'm sure they will be. On the internet, you'll be clicking a box saying you're over 18. And just as a reminder, in the state of Pennsylvania, all children up to the age of 21 receive hearing aids at no cost through the state, regardless of income. So that's only true of Pennsylvania. That's not true in any other state. And it's really fabulous program in the state of Pennsylvania. So we're sure our kids are really well taken care of and have the services and the technology that they need. So I just wanted to talk numbers just for a second to give you an idea of the population here. So when we think about people with hearing loss, we can think about the group that recognizes they have hearing loss and then the group that actually doesn't realize they have hearing loss. And so the people who recognize they have hearing loss, they split into two groups in the middle of this. And what you can see is about 8.7 million of those individuals recognize they have hearing loss and are ready to do something. They want to do something. And that typically, those are the people we see in audiology clinics. And about 3.4 million of those people who recognize they have hearing loss are not ready to do something. And that could be for very different reasons. It could be the cost, it could be accessibility. It could be all sorts of reasons why someone might not be pursuing care. So the advent of over-the-counter hearing aids may impact this 3.4 million people, some of them anyway, and maybe with a little bit less expensive and having a more direct pathway without needing to go to a clinic, maybe they will try something, which would be great. That, this is a pathway that may help some people, people who actually have mild loss and have kind of situational needs. This may be very helpful. And then they'll move into people who are seeking help as well and may stay in that direct-to-consumer pathway or may eventually want something more individualized, and that's fine as well. But I think what's interesting is 26 million people who have hearing loss actually don't realize they have it. And for some of you who follow our research, this is an area that's really interesting to us of how do we get to these individuals, because we know untreated hearing loss is related to all sorts of bad health outcomes, social and health outcomes. And that's happening to these people, whether they know that or not. So some of the support we get from the Eye and Ear Foundation supports that work for us. So I always like to highlight that population. In terms of our pathway to care in audiology, traditionally people come in, we have a large case history, we get to know people and their needs, and then we know their hearing with a hearing assessment, and then we move through to solutions. With people with the over-the-counter hearing aids, if they've bought something that's not working for them or they're not sure how to use it, they can come in a traditional way and we can go through that process. But some of them may just want to come in and have very specific help, like how do I put this on my ear? How do I find the right length? Or something like that. And we'll be set up to help with that as well. And those will typically be an audiology assistant who helps with those things, because you don't need an audiologist. You can have someone who works with us to help with some of those issues. So if you try to, in your mind, kind of separate out where these products are, this graphic, the top is a high price point, the bottom of the graphic is lower price point. The left-hand side means very little professional help. The right-hand side is needing professional help. So hearing aids sit in that right-hand corner. They're more expensive than other things, and you need a professional to do that fitting and training with you. In the middle, a lower price, not the lowest price, and less help would be that over-the-counter hearing aids or hearables that we mentioned. So they could come in many different shapes and sizes. They can look like different things, but they're going to be something that the person gets directly and maybe needs some assistance with. And in the lower left-hand corner is what we call the PSAPs, the personal sound amplification products. And although these are not designed for people with hearing loss, at UPMC, we do use these off-label meaning we do use them with people with hearing loss all the time to help access to healthcare. So you can imagine if you go into the hospital and you have some hearing loss, maybe day to day, you haven't thought it was a big deal, but now you don't feel well and people wearing masks and they're communicating in medical language. And we want you to be part of that decision making. So we make sure in all of our hospitals, you have access to these amplifiers. And they're in many of our clinics as well, where you're going to the clinic to hear advice from your physician or nurse or PA. And we want to make sure you can hear that when you go. So what do audiologists bring to the table? What we do is we individualize solutions. So first of all, that's knowing a lot about the person's hearing needs, and then creating a rehabilitation plan, which could include over-the-counter hearing aids. So the audiologists can sell those just like anybody else can sell them. So for some people, maybe that simple technology will be all they need right now, and we can certainly use that, but along with all these other things that we'll think about along with that person. We individualize the physical fit. We do this with taking ear mold impressions. This can be important to people. So someone with an over-the-counter hearing aid may not be staying in their ear. So they can come to us and we can help them with the device they already own and get that a little more customized, the fit in their ear. And then we individualize the acoustic fit. So this is just showing you a picture of the kinds of measurements we make. But what we're taking on the left-hand side is the hearing results. That's an audiogram. So on the top, across the top from left to right are all the pitches, all the frequencies we hear. And then it goes from very quiet to very loud sounds. So we're mapping the sensitivity of that person, how loud we have to make sound. And on your right-hand side, we flip that graph and set it up so we can put a microphone in the ear, measure the output of a hearing aid, and tune it so we can bring sound back to where the person can hear. And so this is a graphic of that same thing. So the red line here is somebody's hearing loss. Low pitches, they hear well. The high pitches, they don't hear well. And those blue arrows are showing the world of sound. And the goal is to take that world of sound and package it into the space where the person can actually hear. And we do that by putting a microphone in the ear and the hearing aid, and we measure. So this is an example where before we've tuned the hearing aid, that dark green line is showing the output of the hearing aid. And you can see in the higher pitches to the right of the graph, it's not loud enough. It should be up by those little those green plus sides. So if we do a good job tuning it, it's going to then look like this. So we've taken soft sounds and we've made them loud enough for the person to hear. And then we'll take moderate sounds and make them loud enough, but not too loud, et cetera. And that's how we fit a hearing aid. So with an over-the-counter device, a person in a sense would have to do this themselves. And the problem with that is people with hearing loss have been walking around with their hearing loss usually for quite a long time. The average is about 7 years before they decide to do something, although maybe they'll do things a little bit more quickly now that we're going to have over-the-counter hearing aids, but be it that as it may, they're going to have walked around for a while. So their brain is tuned to hearing through that hearing loss. And it's basically a filter. So the brain thinks that is normal. So we always say to patients, if we do a good job fitting hearing aids and bring that sound back, especially those high pitches, it will not sound normal in the beginning because the brain is not used to it. So when you first get a hearing aid, it's going to sound sharp and tinny. It's going to sound too loud. And the key is to wear it all your waking hours. So when you get up in the morning till you go to bed at night, so your brain is listening in this new way all the time, other than when you bathe, shower, or swim. Hearing aids don't want to get wet. But otherwise, you want your brain exposed to all these sounds because that is the only way for the brain to adapt. So the brain adapted to your hearing loss. It decided that was what was normal. And now it has to adapt to having the sound back. And it takes about 3 weeks of full-time use to do that. And so we always say to patients, we work for about an hour to fit hearing aids, but you work for about 3 weeks. And it is work. So the first week or so, things don't sound pleasant because your brain is just paying attention to everything because it hasn't been hearing those low-level sounds. But the only way for it to get used to them enough to ignore them, like someone with normal hearing, is to be exposed repeatedly over that time. And so people are not good at self-tuning that kind of amplification because their first reaction is it doesn't sound good. So if something doesn't sound good, you tend to change it. And that's potentially a problem with over-the-counter hearing aids because you'll have some controls to tune. It's unlikely people will tune kind of to the level that would give them the best benefit. And there have been 2 studies actually kind of mimicking the over-the-counter device pathway. And they did find people don't always tune to what might be ideal. That doesn't mean they don't get help. It's just not to what might give them the most help. More importantly, from those studies, they found the majority of people really did need assistance with devices, that it was not just opening a box and figuring out. It was not easy to just open a box and figure out how to use the device or to connect it to an app on the phone and those kinds of things that are may be required. But once the person has worn a hearing aid for 3 weeks full time, they typically will have adjusted to these sounds. And that's when we have patients come back in when we're fitting prescription hearing aids and we make any changes if there's anything they haven't adapted to at that point. And then it's important that they keep with full-time use because there are good data to show that if you try to wear hearing aids, prescription fit hearing aids part-time, you will never do as well as someone who wears them full-time. And that's because you keep the brain in that adaptation mode of going between listening through your hearing loss, listening through the hearing aids. Now with over-the-counter hearing aids, the expectation is probably the people that pursue these will be more part-time users. They're probably using these for rather situational issues. For instance, maybe they always need the TV louder at home and that's annoying to other family members. Well, then they may be using this device during those times and maybe not other times. If TV is specifically a problem, a hearable actually, which would be less expensive, is a nice solution. So a hearable can Bluetooth connection to the TV and that individual can have the sound as loud as they want. So again, that's a good example of coming in and actually getting a hearing test so we know how you hear, and then talking through these things with an audiologist can save in the long run time and money because they could recommend that hearable if TV were really the significant situation. And then the last part of what an audiologist does is really individualize that adaptation plan, like I said, of how are we going to get you used to these devices. We can tune them down in the beginning and slowly tune them up. We can do different things depending on really the patient's personality of what they want to hear and what they feel they can tolerate. So a cautionary tale, I mentioned Bose. Bose was the first one on the market with a self-fitting hearing aid. And that was a traditional hearing aid, but that could be received right directly from Bose. and they were gearing up to have an OTC product the minute the law passed. And interestingly, they closed this entire division of their company and everyone was fired all in one day. And so their official statement was they have decided to go in a different direction, which is kind of a classic comment from a company. And they have gone in a different direction. So their signal processing is now being used by another company, Lexi, which is a direct-to-consumer company that has support, online support built in. So I think Bo's experience, and I certainly don't have a quote from anyone who's there now, but their experience was, as I said, a lot of phone support needed, and Bo's is not set up to do that. And why would they be? You know, they're not audiologists or an audiology clinic. And so with that, they really felt like this wasn't the business they should be in. Yet they make very good sound quality products. So, you know, they felt like directing that elsewhere probably was a better plan for them. But I think it's a little bit like the canary in the mine here. As audiologists, we knew there would need to be a lot of patient support. And we think that will continue. So I think we'll find some over-the-counter products have that support built in, and some won't. Some will really just, it arrives in the mail, you have it, and there's really no support. So that's another thing people will want to think about when they're deciding what product they might want. Or, as I've mentioned now a few times, or they can take that product and go to an audiologist, and certainly the audiologist can help them no matter what they purchased. So I think my best advice, and then we'll move on to questions, because I see there are a number of questions, which is awesome. I would definitely like to get to what you guys want to know. The best advice I would have is go ahead and get a hearing test. Make that appointment. That's covered by insurance. Get the hearing test, and then the audiologist really can help you navigate this and, you know, tell you if you have the level of hearing loss that is consistent with this category of devices, or if not, help you make a different plan. And over time, we'll hope we can give some good advice as to which products may be good for different people. And that is something actually we're working on right now with our foundation, with the Eye and Ear Foundation, to set up just that kind of test environment here at the University of Pittsburgh, so we can be a clearinghouse and really provide that kind of information, because right now audiologists and consumers do not have that information. And even though you could see what they call an electroacoustic graph of how an over-the-counter hearing aid responds, so you'd have a frequency gain response, that's not meaningful to a consumer. You know, they want to know, is this going to hear me here? Is this going to help me hear in the situations I want to hear in? So we're working with the University of Pittsburgh researchers who do really interesting kinds of testing to create an in-lab test battery that's quick and simple and can be generalized to real world situations, to try to be able to have a consumer dashboard to help think about these devices. So we're excited about that work, and hopefully it will help people navigate this. So let me stop there, and I will stop sharing my screen. And Carrie, I think you and I can manage questions. So I will let you give them to me in any order you like.
Okay, that was fascinating. And thank you so much for that really comprehensive, information about, what this new market we're in.
Sure.
Things are changing. So I'll start with questions. We have a lot. I will get through as many as I can. And if any are like really pertinent and personal, I may save those and we'll get those personal answers to you via email if you answered them. So I'll start with one that we got early in the presentation. Will the service providers at the Eye and Ear Audiology Department be able to funnel their prescriptions and recommendations into the OTC device market?
I'm not sure exactly what that means. So,
okay,
funnel our prescriptions and recommendations. So I mean, I think you're asking if we're going to impact the OTC market. I think what's being asked is, will our information impact the OTC market?
I think so. I think like the other way around, that we're impacting the OTC market as as audiologists?
Yeah, so that's a great question. So what's going to be interesting about the OTC market, when you think about it right now, is wildly broad. So what you're going to see is you're going to see the big 6 manufacturers who currently make prescription hearing aids. They already all have an OTC product. They were ready to do this as soon as October 17th hit. So in that sense, yes, the kind of research in our field and audiologists are involved in those companies. So they've definitely had impact in how those will be designed in terms of just the user interaction, the sound, things like that. Then you have companies more like Bose or Apple who, are going to be involved in this in different ways, who really, Bose actually did reach out to audiology, then they fired all of them, as I mentioned, but they started with that. Apple, not so much, but certainly sound engineers. So people thinking about sound. I think sometimes what gets missed here is the stakeholders, which actually more importantly than audiologists would be the end user, the stakeholder of how hard is this to manage? How do I do this? So, and then some companies will do a better job involving stakeholders. And then you're going to see some kind of one-off companies that think this is a very quick way to make an amplification device and sell them, and then probably leave the market. So we're audiologists are a little more keen on working with some known industry people, because we know they're not going to leave the market. They're going to be here to support those devices. But with that said, part of the point of having OTCs was actually to expand competition, to try to have more people in this market space. So that's a good question. And I think it'll be a real range of which ones are kind of impacted by both consumers and audiologists, and which ones are just kind of not impacted at all.
Thank you. I have another question. I think that a lot of people might be wondering about. So where does this new development in the market leave places like a Miracle Ear type of franchise? Is it, they say that it's optimal to have audiology in a hospital or academic setting, but in many areas, I'm guessing rural areas, this type of distributor is all that's available. So has there been discussion that these retail type entities will carry OTC hearing aids, prescription hearing aid, does this change the nature of their business at all?
Yeah, that's a great question. So first, I do want to say, an audiologist doesn't have to be in a hospital or academic setting. We have great private practice audiologists here in the Pittsburgh area, lots of Pitt grads that have gone into private practice. So, a licensed audiologist who's doing best practices can be in many different situations. So I do want to say that. But that's a great question, right? Because part of the thinking behind having OTCs is we have rural areas where we really have, hearing care deserts. There just is nothing nearby. So either they're driving for hours for this kind of care, which just may not be possible, or they're getting no care at all. And for someone like that, this OTC pathway might really be a very good pathway. And again, I'm someone who's supported OTC hearing aids. It's good to have multiple pathways. It's just good to be realistic about who this helps, this pathway. That is a group this very well may help. So then when you talk about like the Miracle Ear, Beltone, so those are storefronts. They could employ an audiologist. Usually they employ hearing aid dispensers. So those are individuals with at least high school educations and no criminal record, actually, is the rule in Pennsylvania. So, but they train within their job, right? So they have on-job training. And they may be a very good person to go to if you don't have access to anything else. Now, will they be selling OTC hearing aids? That is completely up to their practice. If I had to guess, I doubt it. They'll probably, we all have economy level aids. So if you think about it, two OTC hearing aids will be about $1,000, some $800 to $1,000 only for the devices, for no care. If you come to UPMC, for our economy level device where you get the care and the fitting, that's $1,400. So, and I know that's more, but when you think about that, that might still be a better pathway. So, UPMC really tries to position to be as accessible as possible. So that might be a good decision. But as your comment, the comment of the person is UPMC is not everywhere. We're more places than ever before, but you may have to go with something else. So for that person in a rural place, it's not a bad idea to try an OTC. I would just say they want to make sure they can return it.
Thank you. That kind of leads me into another question that we received about the price of hearing aids at an academic medical center or an audiology office like ours, or at a place, like a Miracle Ear or somewhere that's offering OTC hearing aids, if it's just direct to consumer. Do you anticipate that audiology centers will reduce their costs at all to be competitive? It sounds like they already are competitive if you take into account the care aspect.
Right.
But do you think the price of those type of services in an audiology facility would come down?
No, not the services. So the manufacturers may be pushed a little bit with competition to bring the device costs down, maybe, but I wouldn't count on that because the OTC is really a whole different thing. I think what this is going to help do is really help consumers understand the difference between the device and the services. And that is confusing because typically it's a bundled price. So when you come to audiology, you get a price and the consumer thinks that's the price of the hearing aids when it is not. It is the price of the devices plus the services, and it's usually the services for 2 to 3 years. It's all bundled into one price. So it's interesting, Carrie, I've done a lot of media related to this, a lot of interviews, and something that always comes up is why are hearing aids so expensive? And so I really reject that now. And I want to explain why. So when you think of, standard hearing aids are with all services are going to be around $3,600. That's about for two hearing aids and all the services. So for an individual person, yes, that is expensive, of course, and out of reach for many people. But if you think about it, hearing loss is a chronic condition, and this is the treatment for a chronic condition. And you expect this to be about 5 years, and then you would need a new set of devices, sometimes longer than that. So when we think of treatments for other chronic conditions, that is very inexpensive, actually. And so the problem is that it's not covered by insurance. The problem is not the cost. The problem is the lack of insurance, which is why, our efforts at the national level and certainly with UPMC is really to push for healthcare coverage. That's what we need to do to make things really accessible for people. In the meantime, we support free clinics, and we're certainly, we're happy we can do that in Southwestern Pennsylvania. I did see another question over here if we're doing Mission of Mercy again. Mission of Mercy was a 2-day event where they do dental care, vision care, and we did hearing aids for the first time this year. In 2 days, we fit 229 people with hearing aids. And yes, it's in June next year, and maybe somebody from Eye can put in the chat the dates, but it is in June, and yes, we will definitely be doing it. And I know Carrie will be there, and Lonnie and Craig, everybody helped last year.
Yes, and we will, just to note, the Eye Foundation will highly publicize the dates and, all of the details surrounding Mission of Mercy next year. It was a great event this year, really opened our eyes to the amount of need that there was in our community for hearing care. So we hope to have a bigger presence next year. We're very excited to participate again.
The dates are June 23rd and 24th.
June 23rd and 24th at the David L. Lawrence Convention Center downtown.
And we're at the Birmingham Free Clinic the 3rd Thursday of every week. We're at the Squirrel Hill Health Center the 3rd Thursday of the evening, and that helps immigrants and refugees that come to the country and can't hear. And obviously it's hard to get going in this country if you can't hear and learn the language. And then we're at Catholic Charities in the afternoons on those Thursdays, and Catholic Charities have actually had 2 big weekend events recently where we've been fitting probably over 50 people with hearing aids in the last couple weekends.
That's wonderful. That's wonderful. I'll try to get through a few more that might be relevant to a lot of people. So someone has said, people have told me that Costco has an audiologist on staff to help them get fitted and served with hearing aids. I wonder if this is true, or if this is an audiologist assistant or just a salesperson.
Great question. It depends on the Costco. Some have audiology, some have hearing aid dealers. Costco has a great internal structure for career development, which is terrific. But sometimes the person fitting hearing aids, used to be in the bakery, and that's okay. But that's just a different person than having an audiologist. Some Costco's though have an audiologist. So that's a question worth asking. Costco gets the same technology we do in any clinic. And I always like to make that clear. People think there's something substandard about those hearing aids. They're not. They're good hearing aids from the big manufacturers. Costco doesn't do a lot of customizing the physical fit. So often they'll send people over to us if the person needs that. But that is if you're comfortable getting your healthcare at Costco, that is an option, and it will be less expensive because they buy in bulk, just like they buy anything else. We do see a fair amount of patients who start at Costco who just don't quite get fit maybe fully the way they want to be or should be. And so we can see them. Some of the hearing aids from Costco are locked, which means we can't change them, which means you need to go back to Costco, and some aren't locked. So then we can make changes. So it's just good questions. I mean, that was a good question. And if you go to a particular Costco, just ask about the training of that person, and then you'll feel a little more comfortable.
Great. We have someone asking if, in your opinion, is it too early to assess if all of the over-the-counter hearing aids are equal in quality?
Well, they're not equal in quality. So I can say that kind of point blank, but yeah, we're super early, right? Because we're just seeing things come. Now, some people were ready to push things into the market. We're just seeing them. Some of these products will be on the market for a few months and be gone. Then the problem with that is then there's no support, obviously, for that kind of product. But this will all keep shaking out, in the next 6 months or so. Maybe it'll be fun to do an update next year, Carrie, like what we know a little bit more. And hopefully with the project here, we'll be doing some measurements and can talk a little bit more about that. But the person asked a good question. There's going to be such a range, and that's going to be very hard to navigate for consumers. And I feel for consumers, that's going to be difficult.
Is in that same line, or is there, that you're aware of, any type of regulation as to the quality of the devices?
So the FDA rule gives certain parameters, like it can't be louder than a certain level. It has to have a certain bandwidth, like frequencies. So there are rules within that. What we have to remember is the FDA doesn't have its own police force, right? The FDA has a rule, and it's meant to enforce that rule, but they don't actually really have that mechanism. So it's important for consumers if something's not right, if they get something and it isn't doing what it said it would do, they should file that at least at the state level with consumer protection, because that actually is the only way the FDA then knows if something went well or not. And the FDA for the next several years will be collecting all that information to then reevaluate where we're sitting with this rule and if things worked. So I hope people will do that. And I mean, I hope people will have good experiences, but if they have a bad experience, it's worth reporting.
I'm sure many would want to know, in your opinion as an audiologist, if any of the brands are recommended, obviously taking price into account, but if there are any recommendations you could give as to a brand or a type.
No, there really isn't. It just depends on what it does, and we don't know that. But again, I'll put a plug into the work where Carrie, you're helping us with this, looking for the right funding to get this going, because everybody wants to know this, right? So I think having that kind of clearinghouse and having this information will be really helpful to people, but we don't have that right now.
I think I will ask 2 more questions, and there are probably a few here that we can get the questions to Dr. Palmer following the session today and get those to you directly. We have a question that says, Medicare Advantage programs are now offering hearing support. Do you see this helping in both device and service pricing?
Yeah, and the question above it, Carrie, I'm going to answer both kind of combined. So absolutely. So your Medicare Part B does not cover hearing aids, and it will take an act of Congress to change that because it just wasn't included in original Medicare. But the Advantage programs, what you think of as Medicare Part C, does sometimes have some coverage, and it's worth looking at when you're making that decision, and everybody's making that decision now. Typically, the Advantage programs have had something like $500 or $1,000 towards hearing aids, and then you pay the difference. And that certainly helps people. It doesn't help people who don't have any resources, but it certainly helps a lot of people. So what you're going to see, the UPMC for Life plans, which have had typically something like that, starting in January 2023, UPMC has teamed up with a third party called Amplifon. And Amplifon is not a hearing aid, and it is not a hearing aid company. It's a third party that is a delivery system in terms of covering hearing aids. We already work with them for the people who work at Pitt right now has the Amplifon benefit. The nice thing about Amplifon is we can work with you and pick any device, any manufacturer, and get the right thing for you. And then what's happening through that with the new UPMC for Life program, it's a discount program. So you will pay less than you would have paid if you were paying our direct fees, and you get all the same services and great devices. So that's why UPMC, rather than figuring out insurance of their own, they're teaming up with a third party. And we are very familiar with working with Amplifon. So, we're certainly happy to see you with that benefit and get you what you need. And Carrie, I have to put in one more plug because someone asked about pharmacists. And we happen to have our faculty member, Elaine Mormer, here at the University of Pittsburgh with her colleague, Luke Barenbrock, who's in our pharmacy school, created the training program that pharmacists are using to learn about hearing and devices. And we're so excited that they did that because we'll have informed pharmacists that'll help people navigate and also know what are the contraindications to self-care and know to refer to audiology. So we're feeling really good that pharmacists do have a pathway to be educated, and it's thanks to University of Pittsburgh people. So we're very proud of that.
You're right. I think we should all be very proud that that came out of our university. That's very, very cool. I'd like to just ask one final question, because this is a question I think you can answer. And many of us who have had loved ones who have, gone through the experience of needing and then procuring hearing aids. What would you say you could offer as in terms of advice to people who would like to convince loved ones, family members to address their hearing loss, and maybe make that step towards getting care and getting hearing aids?
Well, it's funny. I was seeing patients yesterday, and someone came in, and I love this. They just, the whole family came in and got hearing tests and just didn't make it about one person. And it's like, what, let's all get baseline hearing tests, just like we get vision tests. I mean, that makes sense. And that's when it's nice to go to an environment like UPMC. There's no pressure to do anything. It's good information. You don't need to get a hearing aid. So I think assuring the person, we're all just going to go figure out how we're hearing, and then we can kind of make a plan. And sometimes if a couple of family members do it, it somehow just lessens it's all about you, and we're kind of focused on you. So I think that's a way to do it. I think now with online hearing tests, they're not perfect, but that's a way to do that in your own home, kind of privately, to get a little bit of sense of your hearing. I think that's not unreasonable. And OTCs could be a way to just try something and see if having a little amplification just makes things easier and help you start on that pathway. We're thinking we're going to see Christmas gifts this year, adult children buying OTCs for their parents. And I've been very clear with my boys, I don't consider that an awesome Christmas gift, or an iron ranks up there too. So I personally, that's not what I want to receive, but I think maybe we'll see a little bit of that.
Thank you. I think that would be the last question, so we can end on time. There may be a few left in the chat that we'll ask you directly, and
Sure.
Those of you who ask them, we'll try to get you those answers soon. The recording of this webinar will be available on our website in a few days. And I think we should go ahead and schedule an update for next fall at this time, to see kind of where we are. This is all a new field. So we're very excited to see how this turns out. So I want to thank you for taking time to share your knowledge with us. I want to thank everybody who attended today. And we hope you have a great rest of your day. And, as always, if you need more information, www.ioneer.org. Thank you again.
My pleasure. Thanks, everybody. See you next year.